name is Xuan. I'm one of the doctors in St. John Ambulance. I started in St. John as a cadet in South Australia, and I joined St. John Victoria from Mildura, and I'm still with the Mildura division at the moment. I first joined St. John as a cadet in South Australia when my friends said, St. John will be fun, you should come join the first A competition. And so I joined as that, and I really enjoyed going to events. I really like going to big events like Adelaide Oval, the Royal Adelaide Show. And when I started university, I came over to Victoria and I joined the Mildura divisions when I was doing my clinical placement in the Mildura-based public hospital up there. Well, I think St. John Ambulance has a lot of healthcare professionals. We have enrolled nurses, we have resident nurses, paramedics, and we have doctors. And we run a lot of the medical assistant teams in really high risk and big events like music festivals or high risk sports events. So that's how we can provide a more high level care on the ground for our volunteers and attendees. John, when I was in year 10, actually opened me up to what studying and working in the health field is like, and actually inspired me to apply to medical school and go down this path. I think for students, St. John Ambulance is a great opportunity to get more hands-on exposure outside the hospital and really being supervised and guided by senior clinicians in these very unique pre-hospital environments that is not readily available for students in a hospital setting. So these medical assistant teams are usually set up in really big, high-risk events. They're like mini field hospitals. We have a lot of the medications that you might see in the hospitals, with a lot of the equipment that you might see in the hospital. Essentially, we are bringing the emergency room to the field and provide on-the-scene adequate and appropriate care right there when it's needed the most. And then we can stabilize the patient, then for transport to hospital to be provided more definitive care. I think as a future doctor in training, I think St. John Ambulance gave you great exposure to not only the clinical side, but also the networking of learning from seniors, but also learning to meet with people from all walks of life. I think with St. John Ambulance, we have volunteers that might be teachers, they might be mechanics, and I think learning their stories and learning why they have joined St. John and volunteered for us, it's really eye-opening, and I really enjoy that part, and that's why I'm still here.